State health officials say as of April 30th, there have been 16 residents and 35 staff members who have tested positive for COVID-19 at the Kingston Health Center located in Southwest Bakersfield. And the Kern County Department of Public Health said on Friday that Kingston requested immediate help with staffing shortages. And by Saturday night, 35 healthcare professionals throughout the state were sent to assist the facility. And those staff members will remain in place until Kingston can reliably provide adequate staffing. In a statement sent to 23 ABC, the nursing home says they are currently working with health officials to manage the confirmed cases. And, quote, California Department of Public Health is on site daily at the center and working with the center staff to ensure infection control processes are being followed and assisting with some staffing needs. They also say they've increased their housekeeping services and currently have appropriate personal protective equipment for staff. Attorney Matthew Clark says families with loved ones in the Kingston facility have reached out to his law firm about the quality of care since the COVID pandemic.
And look, I understand families are frustrated. I mean, imagine for a moment having a loved one in a elder care facility. Based on the media's reporting that there's a COVID outbreak within that facility, and you can't even go in and see your loved one.
He says over the last 3 years, his firm has had around a half a dozen cases against the facility. In fact, 23 ABC reported back on April 24th documents which showed the California Department of Public Health cited the Kingston healthcare facility more than 14 separate times since 2015. Just within the last 6 months, they were also cited with a AA citation, which is considered one of the most serious violations.
All of those cases, so any case we've had against Kingston or any other elder care facility for that matter, it almost always results from inadequate staffing. It's an inadequate level of staffing that leads to poor patient care. Poor patient care leads to poor patient outcomes. Poor patient outcomes, especially in the elder care world, oftentimes leads to death.
Clark also says that the best way for people to review nursing homes is by going to Medicare.gov. Here you can look up any skilled nursing facility and check their ratings, quality of care, and staffing ratios. However, when 23ABC checked Kingston's profile today, their ratings had been removed, and their site was listed as a special focus facility. According to the site, facilities receive this icon if a nursing home has had a history of persistent poor quality of care, and they are now subject to more inspections and potential termination from Medicare and Medicaid, among other things.